Welcome to this channel, Meet Today with Reverend Elosi, whereby we are discussing the life issues that affect us. And today we will be discussing the mental health in the midst of this pandemic. We would like to welcome our guest today, Elder Daktari, on psychological matters, who will be helping us to discuss all these issues and even being able to get into the depth of it and analyzing everything revolving to these mental issues. And so, Daktari, maybe you can take a moment and then introduce yourself to us.
Thank you very much. Dr. John Mwaura, that's my name. I am not very new to Nakuru. 70s and 80s, I was a very active member with the Presbyterian Church, Dr. Other, Left Valley Presbytery, Nakuru Presbytery, and then after that, I was away for a good number of years. And for those who know me, I'm sure they knew me as a teacher, and for many years in Nakuru. Later on, after going to United States, I decided to change my career a little bit, even though I'm still a teacher.
Okay.
I have taught at the university for 17 years in US. So a teacher is always a teacher.
Yeah, definitely.
The last 5 years I've been in Kenya, came back with one goal, because I wanted to give back to my community, the community that supported me to go to US.
Okay.
And felt really the need to come back. I am now running a dialysis clinic at Apollo Center of Kenyatta Avenue as the first private clinic in Nakuru. And we thank God, because that clinic is not just a clinic, it's a ministry to many.
Yeah.
We have been able to provide even finances to those people who are not able to meet their health challenges. And to me, it's not a money-making business. It's a ministry that God has put in me, and we are happy for what we are doing.
Oh, thank you.
In addition to that, I also a member of the Presbyterian Church back in the United States, the Westminster Presbyterian Church, where I'm also an elder, and also ministering to a group of refugees. Over the last 3 years, we have a group of about 150, 160 on average of refugees coming mainly from Congo.
Okay.
And because they don't understand, they don't speak English, it happened that I speak Swahili, my wife and I, and therefore we had the privilege to minister to them, and our church has welcomed that ministry and supporting it in a big way.
So it's basically a service in Swahili for, like, it's now for the Africans only.
Correct. It's a Swahili service for the Africans, particularly the Congolese and the other people who from other African countries that have joined us.
Okay.
So yeah, that's where we are.
Wow. And now on mental health, where do you come in? You are an elder,
right.
You are a teacher, you're running a dialysis clinic, you're ministering to the refugees. Now, on mental health, where do you come in?
Where do I come from? Let me say about my education. My first degree is in Bible. That is, I went to Lancaster Bible College. That's where I went for the first degree.
Okay.
And then for my master's degree, I went for Counselling Psychologist, still at Penn State.
Okay.
And then for my PhD, I worked on counseling psychology, and also adult learning at the same time. So then over the last 17 years, I've been leading in the mental health in the state of Pennsylvania. Mental health is big in US, and one of the things that we have done, and I was the chair in the US, was formulating the policies that will guide the mental health in the state of Pennsylvania.
Okay.
In those early 90s. I have worked in the hospital as a clinician, and later on teaching psychology courses at medical school. So it has been 9
it's
years.
It's all in you now. It's so much in the blood.
A lot of teaching on the parenting, on child psychology within our own Kenyan community in US, and many other conferences in US.
Oh, and now we have you back.
I'm now back
to motherland, so that we can
much
deal with this.
Now. But if you go to US, I've done a lot of presentations all over the US on many issues of the mental health.
Now it's time to come back now, so that we can be able to talk about this. It's like a huge elephant actually in the Kenyan society, but we don't really know exactly, is it real? The mental health issues, is it something real? Is it witchcraft? Is it a curse? Because we just see people running around, they are already mentally sick. And we think, oh, okay, I think your grandmother cursed you.
Right.
I think you stole somebody's goat and you are bewitched. So what is the truth that revolves around mental health? Is it real?
Mental health is real. It is very, very unfortunate that Africans, we really don't believe on mental health. It is very much stigmatized. Just a simple example, when HIV started, not very many people wanted to go to seek help because of the stigma associated with HIV. Today, people have come to a point of acceptance, and you can see people who are with HIV, they are living longer because they have accepted the reality and they are taking medication.
And they're having families
and everything else, and life continues. Mental health is the same case, especially in the early 70s and 80s. It was very, very difficult for anybody to disclose of any mental health. They all quoted such a person as Mwaura.
Somebody is crazy,
yes, mad. And it's very unfortunate because I remember, and these things have not changed, that if you have a mental health, you are admitted in one ward, all of you. I know, for example, in Nakuru, I believe we used to call it Ward 8. Ward 8 ilikuwa ward ya wasimu wote.
And Mathare, Ward 9.
All of them. And what come to realize is that we didn't have the trained staff either, because everybody was trained in one format to look at these people as crazy people.
Yes.
But in mental health, just like other sicknesses, there are different kinds of disorders. We call it disorders. And there's a book, our manual, just like in medical field, we have a manual that we use for medication for diagnosis. In mental health, we have what we call also DSM.
Yes.
That is diagnosis statistic measure. That categorizes all kinds of mental health. So I may have a child, there are some disorders that are for children and not necessarily for adults. And we cannot treat them all the same. There is what we call bipolar, for example, schizophrenia, and all those. We talk about the panic, the PSTD, that is post-traumatic disorder, all those kind of things. But unfortunately, Africans, we have even up to now accepted fully, especially in the rural areas, that mental health is a problem.
We think somebody has been bewitched.
And that's what we believe because of our traditions and our African heritage. Our African heritage, there is this about the curse, Ilumi and what have you. And I don't want to minimize about that because the traditions are very strong on that. And it's about faith and it's about what you believe in. But there are things that are really going beyond what you're causing curse that are mental health. And they have never been addressed. And we have found people in the families really suffering with those issues and not seeking help.
And they are not being brought up. And that is why now today we would like to look into this and even be able to know, because you've told it's a sickness like any other.
Correct.
And it should be treated. And is it possible for somebody to be treated and be normal? Completely normal?
Let me say this. Mental health cannot be cured. It is very discouraging. If I use that term, can be very discouraging that mental health cannot be cured. But mental health illness can be managed. It can be managed.
For somebody to live with it.
For somebody to live with it and to be able to function. There are some kind of disorders, we call them disorders. There are some or kind of form of sicknesses that one can overgrow them. For example, teenagers, many of them are very quick into what we call eating disorders.
Yes, it's a mental sickness?
It's a mental sickness.
Eating disorders?
Eating disorder.
Too much and too... Okay, Dr. Now.
Eating disorder.
How does eating become a disorder and related to
mental health?
Mental health.
Let me give you an example. We have... this affects especially the teenagers and especially the girls. The girls, they look at the bodies of other images from the media and they admire what they want to look like. And in the process, they become completely possessed that they are putting weight, even though they have not put weight. So what they'll do, they'll eat food and they go to the bathroom and then vomit. And this is a continuous. When the behavior becomes consistent, several times a week, then it is categorized as a mental disorder.
So it is what you have in your mind.
It is what you have in mind.
And then it's reflected in your behavior.
Correct. And it can be, in fact, it has led to many girls suicidal. Many eating disorder. Not long ago, I was treating a girl just here who had completely lost weight. And it took forever to bring this girl back to normal. Such a disorder, a child, as she grows, can overgrow it and realize, because some of this is irrational behavior. We call them irrational behavior. It can be overgrown. But before they get to that level, a big damage can be done.
Has already been
Has
done.
been done. This
So
child may
if
not
there
concentrate
is
in
no
school.
help,
If no help,
if the parent doesn't realize that
Correct.
the child is trying to imitate a Kardashian on the
correct,
TV,
correct.
a model they saw on the TV,
Yes,
they are just going to be ruined and maybe eventually lose weight.
Absolutely.
I mean, lose weight to death, like starving themselves to death.
it has happened, even committing suicide.
And at that time, we think that maybe the child has other issues. We don't realize that it's something that needs to be looked into and be helped to deal with the mental issues.
It doesn't come alone, and you're right. It has some underlying factors. But what is exhibiting most for the teenagers, you find that what can be seen is eating disorder.
Okay.
And the schools may not realize, because this child you're hiding. They just see the child losing weight.
Do boys try to, like get the muscles, the biceps?
Yes, the
Is
truth
there
that
anything that is related to that with the boys?
boys, unless it is not very common to the boys as much as it is common to the girls.
Okay.
The eating disorder, the prevalence is high rate
In the girls.
in the girls
Okay.
than in the boys.
Okay, now that you've mentioned that, I'm just wondering, do we have some of the mental health issues which are genetic, which are hereditary? That I got this because my mother had this problem, or my dad and my grandfather, so this is where it's coming from. Because when we look at the African setup, if the grandmother had a mental health issue, then the father, and then the child, we say it's a generational curse.
From the scripture from the Bible point of view, because we call it a scripture curse. But let me say, mental health disorders or illnesses can be also genetic.
Okay.
And it can also be environmental.
Mm-hmm.
It can be genetic, it can be environmental.
Mm-hmm.
For example, eating disorder is not necessarily a genetic. It is an environmental factor.
Yeah.
But there are some others that are genetic.
Mm-hmm.
That if your parents or your generations in the far away, they had similar diseases, there is likelihood that those symptoms may surface in the other person. Okay. Very high likelihood. It may not, the degree in which it is exhibited may differ, but you are still going to see the symptoms servicing to that individual.
Okay.
There are some that are genetic, for example, bipolar.
Okay.
Bipolar, if I explain what bipolar is what we call is a mood swing.
Yeah, from extreme to the other?
From one extreme to the other. Then you can come to other things, we call it schizophrenia. Schizophrenia is where you can start seeing things, you can hear things talking to you, hallucination. What we call, those are audio or those kind of visual hallucinations.
But only you can see them and hear them.
Nobody else can see them because it's illness.
Okay.
You can see somebody saying, "Don't beat me, don't beat me," and there's nobody. But
there's
hearing
nobody.
the voices
That's
and struggling.
That's when we say they are already fully mad.
And that's when you take them to 48.
Yes.
Unfortunately.
Okay. So now, up to that point, maybe we can take just a short break, and then when we come back, we will see how these mental health issues now can relate to the situation that we are in. We'll come back now closer to where we are. The pandemic is here with us. What do we do? And do we have these issues reigning with us? Okay, we take a short break.